Hi, this is Roger Price, and you're watching the Best Practices Show.
Hey guys, thanks for watching the Best Practices Show, where we take a look at the best business practices from the best dental practices all over the world. And the hottest topic in all of dentistry is called sleep. And today I've got an amazing guest. You do not want to miss this. And we're going to talk about the major problem with sleep issues in dentistry. You're going to love this with Roger Price. So do me a favor, grab a pen and hit the share button. Just sit back and you'll absolutely enjoy this. Now, a couple show notes. We are shooting this live on Facebook. So as you're watching it, if you have questions about this hot topic, add them to the feed and I'll ask Roger while we have him on the show directly. Or if you're watching them later on and you have questions like many of you do, continue to add them to the feed and we'll do our best to get back to you because we want you to get the most out of this. You guys are doing an amazing job sending us suggestions for shows. And Roger, that's how I got you on here, is all these people want to hear about things that are relevant and important to them in dentistry. So keep sending them to us. And I love the shares. You guys, thank you so much. Again, up over 39,000 followers on Facebook, over 150,000 of you on iTunes. And all I can say is thank you. Now, Roger, you came to us from a group of people that are like, you got to get Roger on. So I'm like, okay, we got Roger on. And so Roger, now I want you to share with people who you are, and your story is extremely fascinating. Then we're going to talk about the topic and why, and then we're going to go into the details. So I know who you are, but if somebody's watching this and they don't know who Roger is, who's Roger Price?
Okay, he is a guy who started off as a pharmacist in the mid-1950s in South Africa. And believe me, pharmacy in the mid-1950s was nothing like it is today. If you took the medicine, you were better in a week. If you didn't take it, you were better in 7 days. It didn't do any harm. It didn't have warning labels. It was all handmade. It was all compounded stuff. It was aspirin and orange flower water and syrup and all kinds of things. Life was very simple then, Kirk. It's too complicated now.
Right.
I mean, today you get a prescription for sleeping pills and it has a warning label which says, these pills could make you drowsy. I mean, go figure.
Mm-hmm.
It's insanity. Okay, so I got out of pharmacy after a couple of years because it didn't make sense having to make 6 repeats of the same medicine for the same problem and not find out why we had the problem. So I became a clinical nutritionist. I became a body worker, a remedial massage therapist. Just to summarize it, if it had an ology or an opathy at the end of it, I had to go at it. Because I wanted to try and find out, why did people develop problems? I knew we caught 4 things. We caught viruses, bacteria, parasites, and fungi. But you can't catch rotten tonsils. You cannot catch crooked teeth. You cannot catch clenching and grinding and airway issues and disturbed sleep and poor breathing patterns. You create all of those things as compensations for something that's not going right in your life. And of course, one of my most passionate people to follow was Isaac Newton, who back in 1642 made one comment which has stayed with me all my life. For every action, there is an equal and opposite reaction. Mm-hmm. So if our dentist colleagues are seeing people coming across their doorways suffering from reactions, surely it makes sense for us to look to see if we can find the initial action which prompted that reaction. And that is what I've spent the last 25 years of my career doing, working with dentists, orthodontists, predominantly Why do children get crooked teeth? Why do they develop narrow palates? Why does that palatal arch then go into the nasal cavity and affect the nasal breathing, causing the mouth breathing, getting us into these various cycles and loops? And I've been blessed to become involved with some absolutely incredibly amazing people. Jeff Rouse, Barry Rayfield, the list, Tom Colquitt, the list just goes on and on and on. And surprisingly enough, so many of these people are in their 60s and 70s. And yet they are awake enough and alert enough to understand that, yes, things have to change. They cannot remain the way they were 50 years ago. So this is what drives me. This is the passion. This is the excitement. This is the watching the eyes open and suddenly you hear, yeah, I got it. I see it. And we are on the cusp of a major paradigm shift. It's a very exciting time to be alive in the world of dentistry.
And I couldn't agree more. I mean, it is an incredible time. And, you know, Roger, as you and I were talking before we went live on this particular broadcast, I want you to talk about the why before the how. Why is this subject so important? And why is it so important for dentists to have a really clear viewpoint of all of this?
Okay, by the time somebody gets to see a doctor, they're already sick. Dentists get to see people very early on. Most parents bring a child in for an office orientation around the ages of 2.5 or 3, just to walk into the dental office, to sit in the chair, to play with something, just so that later on, for them, it's not a foreign environment. If the dentist knows what to look for at that age, we can pick up so many very simple dysfunctions at that age and correct them before they become long-term chronic issues that require extensive intervention. The dentist is not restricted like the doctor is. The doctor really can only do what the insurance company says or what Medicare says. Doctors are allowed a limited amount of time with each patient. They cannot talk about more than one ailment at a time. They have to make another appointment, which is inconvenient for everybody. The system does not work in the interests of health. We are dealing with a disease management business, which is obscenely profitable, but it is not health prevention oriented.
Amen, brother. Amen. So what's the major problem with sleep issues in dentistry? Let's just talk about that right now, and then let's do a deeper dive.
Right. The major problem with sleep issues is that they're not sleep issues. And I'm pausing deliberately so that everybody can get their knickers in a knot and start fighting with me.
I know where you're going, and I love it.
It is not a sleep problem. Sleep is a natural function. Sleep is a physiological, anatomical, biochemical, nutritional function. We should not have to have sleep medicine because sleep is not a disease. The disease comes from the fractionated or the disrupted sleep. And the sleep is disrupted not because people can't sleep, but because they can't breathe. So you either wake up or you die. Not much of a choice, is there?
No.
So when you have a critical look at the two gold standards in sleep, the CPAP machine and the mandibular advancement splint, neither of those are sleep devices. They are breathing devices. So if the focus is on this thing called sleep disordered breathing, the solution is going to be looked for in sleep. And the only way that you can do anything about sleep is to intervene after the event. This is why they're asking the right questions and looking for the right answers in the wrong places.
Yeah, and let's go a little bit deeper on this too, because here's why, if you're a dentist and you're watching, why do so many people, Roger, try, because this is hot. This is a very hot topic. But you see this, dentists all the time, they come back, they try to put it in their practice, and then they just stop. Like, talk about why that happens.
It's very, very simple. This is the old square peg in a round hole. Dental offices survive on order, on a fixed amount of time, 10, 15, 20, 30 minutes, for a fixed procedure which has a code, which has a billing amount. The front office is in control. The front office makes sure that X $100 per hour is earned per operatory. Break that system, and your front office is going to sabotage your efforts.
Mm-hmm.
Because you're messing with their system. Now, you cannot look for an underlying emotional or behavioral disorder in 10 minutes, 15 minutes, or 20 minutes in a dental chair. It's the wrong environment and it's the wrong amount of time. The second problem is dentists do not get reimbursed for education. So you've got your double whammy, you've got your front desk bearing its fangs because you're wasting time for which you're not getting paid, and the numbers are going to reflect that at the end of the month. So let's take all these good ideas that he brought back and she brought back from last week's conference, and let's quietly put them into a drawer, and let's out-fumble our dentist and get him or her back to what they should be doing.
Right. So
I've seen that over 20 years.
Oh, it happens all the time. You know, we call it positive avoidance. Just stay away from the dentist. They'll be fine. In a couple of days. They'll be back to where they were before. Now, I hear what you're saying, but if I'm a dentist watching this, then Roger, what do I do? Like, let's start to talk about a direction or a solution in here in the future.
Yes, the direction is to understand that what they are dealing with is not a dental issue. It is a behavioral issue. Mm-hmm. So in addition to doing the dental imaging, which is your cone beam, which are your models, which are your panorex, which is your physical examination, it's time for the dentist to start to do some physiological imaging. And this is what I call lift your loop and look. Look at the person who is in the chair. Look at their hair, look at their eyes, look at their skin. Look at their lips, are they dry and chapped? Look at their fingernails, are they biting their fingernails? How are they lying in the chair? Are they breathing from the chest? Are they breathing from the diaphragm? Look and see what is it that contributed towards that person lying in your chair. Because teeth do not walk into a dental office by themselves. They're always attached to somebody. So the concept of lift your loop and look is, by all means, do what you're trained to do, which is the dental evaluation. And then pop the loop back on the top of your head and look and see what you're dealing with. Now, it is not difficult to learn how to assess what's going on. Mm-hmm. That doesn't mean that you have to do something about it yourself. You don't take your own x-rays, you don't do your own cone beams, you don't take your own impressions. You have a trained team to do that. We can train a team after the initial assessment has been done to look after the issues. Mm-hmm. And more importantly, if the dental office does not want to do that, but understands that the patient will benefit from it, there is access to online services which the dentist can refer the patient to, run by qualified, certified, practicing educators. Right. And this is something that's never been available before.
Right. Now, you're one of the few that's accredited, so explain what that means in that type of education.
Okay. Certification needs to be done by a licensed education authority for it to have any weight or any meaning. Mm-hmm. Anybody can do what we call a clip-out certificate. You can pop it on your computer and you can say Jimmy Jones is certified as a left foot, right-handed shoelace attire because he or she attended 3 days. But it means nothing. What I've spent the last 10 years doing is working with a licensed university that will be accredited by the end of the year, because accreditation takes time. You have to be in existence for a minimum, an absolute minimum of 5 years before you can even apply for accreditation. Then you have to jump through more hoops than a circus in order to make this happen. So this question of how valid is the certification, it needs to be a certification based on academic credit, not somebody who taught something over a weekend in a weekend warrior course and said you're now qualified.
Right.
And I believe the only time that we will be taken seriously is when the people doing these education routines are properly certificated through an educational institute.
Yeah. And this is a hot issue. I always love a little controversy, but you almost got into a fist fight with somebody else over this whole deal. And can you just share that story? Because I'm sorry. But it's a hot topic no matter where you go. And people are using their elbows to proclaim their, knowledge on this.
Yes.
So share, yeah. So maybe you don't want to share that story, but that's fine. That's totally fine. Now, wait. Yeah. So go back to this. Now, as far as the issues here, I'm still going to ask you the point blank question, which is, if I'm a dentist watching this, Roger, can I make money doing this? And the other thing is I think it's really important to say these issues are not going away. I mean, airway issues, this is going to come faster, and we're going to be able to see this more and more and more every single day, almost with the majority of our patients every day. Agree or disagree?
Well, I think now is a very good time to air that 2-minute video, which is going to explain why this is going to become a bigger and bigger and bigger issue, and why dentists are perfectly primed to take advantage of this.
Yeah. So Ben, do you have that video?
Okay, we'll just keep on rapping in the meantime, and I'll do a...
Let's do this. We'll leave it in the link, and people can watch it, but we're going to encourage you to watch it.
Okay.
How's that?
Then I'll just summarize it for you. It is a 2-minute video, which was recorded on the MD channel by Professor Barbara Phillips, who was the head of medicine, sleep medicine at Kansas University. And she pulls no punches in saying why it has failed. It's failed because it's become too expensive, too complicated, not available to the people who need it, too test-oriented, where it's all about everything other than the person who is suffering. And it's really worth investing 2 minutes and 7 seconds to watch what she has to say. So I'll segue from that into why dentists are better situated to do this than doctors. Because it is structural. It is an airway issue. But why do we have an airway issue? Airway issues don't just appear. Airway issues are created through dysfunction. When people have to do the best they can do to take the next breath. And if it means standing on one leg, closing one eye, looking up into the trees and singing God Save the Queen in Swahili so that you can take that next breath, the body will do that because it wants to survive. So it creates a parafunction for that particular issue. Then that parafunction, when repeated, becomes a dysfunction. And you repeat the dysfunction enough times, it becomes your new normal. And everybody thinks they know how to breathe because they're still sort of alive. But less than 10% of Western populations know how to breathe functionally. Really? Most people's breathing is dysfunctional.
Really?
Yes.
Give us some understanding why. Like, why is it just, I mean, there's so many different theories on why this is happening now.
First of all, we're designed to have 32 teeth in our mouth. We're designed to have nice, big, broad jaws so that we have nice open airways. We're not designed to sit behind computer terminals, microphones, and motor cars. We're not designed to eat what looks like food, but actually is not food. Children are not designed not to chew. Children are not designed to eat gloop out of a bottle or a tube. It's our lifestyle which is creating epigenetic change, which is taking the genotype and replacing the genotype with a phenotype. And phenotypically, we are suffering as a consequence of the way we live. And this is manifesting itself in the way we talk, the way we stand, the way we sit, the way we breathe, and the way we sleep. We are creating these things. They are not genetic in most cases.
Fascinating. It's
okay.
Absolutely. Yeah.
So now you can see why the emphasis should not be on sleep, disordered breathing. It should be on breathing, disordered sleep. Because then we can intervene during the day when most of the dysfunctional habits are created. We're up and about 2/3 of our lives. We're only in bed 1/3 of our lives. Why are we focusing on that 1/3 when we're in bed to try and intervene in something after the event? So it's behavioral, it's nutritional, it's emotional, it is stress-driven, it's habitual, it's learned behavior patterns. All of these things contribute to what walks through the doors of the average dentist on a daily basis. The end-stage comorbid sequelae of dysfunction. And that is where my passion lies, 100%.
And you can see that clear as day. What are some other considerations that we need to know that we may not know in dentistry right now as we look at this huge push for this type of education?
Okay, well, first of all, we have two warring factions. We have the ADA on the one side, who on October 23 last year issued a policy confirming how important it is for dentists to become involved in airway. And on the other side, we have the AMA, hell-bent on having dentists have nothing to do with sleep. Sleep is their bailiwick. Sleep belongs to them. Well, I have the answer to that. Leave sleep alone. Focus on the airway and the breathing, and you will not be accused of practicing medicine without a license. It's just a crazy situation. I mean, look at medical specialties. There are 124 medical specialties to look after the 11 systems of the human body. Not one of those medical specialties has anything to do with the mouth or the teeth. That's relegated to the B team. It's crazy, but that's the way it is. Well, we're not going to fight the establishment. We just have to talk to our medical colleagues and say, your expertise lies in the field of medicine, symptoms, drugs, drug management, surgery, etc. Our expertise lies in why these things are happening. Let's work together so that we get the optimal outcome for the patient.
And we are making a little bit of progress in this, aren't we? I mean, we see a little bit of progress. I've had Jeff Rouse on here many times, and I feel like the world is at least waking up to the airway issues, and we're starting now to collaborate, but maybe not as fast as we should.
Exactly. There's no question that we are making inroads. Michael Gelb and Howie Hinden, with their AAPMD, with this big new meeting happening in November at Red Rock, bringing together 3 different groups of people. I mean, the AAPMD says it. It is medicine and physiologic dentistry. You cannot divide the human body into silos, because then you get to the situation where my silo is more important than yours. You cannot think outside the box, because that's the trap. If you're saying you're thinking outside the box, you are accepting there is a box outside of which you have to think. There is no box.
Mm-hmm.
The human being is not a box, and it should not be treated as a box.
I love your perspective on this. Now, we're going to have you back and just discuss so many different issues. But Roger, one of the things that you do is you have your own, not only educational resources, but you have an online university. Give us some sense of what it is that you teach, or what do you do when it comes to this issue that you're so passionate about?
So let's clarify it so that the necessary authorities don't take umbrage. Mm-hmm. It's not my university. It is an established university called the Graduate School of Behavioral Health Sciences. And it has 3 major courses. The one course is a 100-hour, 12-week certification in orofacial myology, producing certified specialists in orofacial myology, which essentially every dentist watching here today will know is a very fast-growing area of guaranteeing that the work done on the orofacial structure is not hampered by the muscle patterns, the entrenched muscle patterns going back to where they were. Okay. So that CSOM course is a certified course. It's a certification which cannot be removed. It is not dependent on an annual fee. It's not dependent on being a member of an organization. It is a valid university-issued academic certification. The second program is called the CBBA, which is the Certified Breathing Behavior Analyst. And this is also a 125-hour 12-week academic program that earns 6 academic credits and is the precursor to a master's in applied breathing sciences. And if somebody does the master's in applied breathing sciences, they know a lot more about breathing and sleep than most doctors do. So, given today's incredible technology, such as we're experiencing now, the decision was made to do live interactive webinars, which are recorded and available basically within hours for review or for revision. So there's no cost of leaving home, there's no accommodation, there's no travel, there's no time away from home. These courses can all be done interactive online. And my role here is to look after the professional relationship, interaction between what I know so well, which is dentists, orthodontists, and practice, and what the university knows so well, which is online education through a licensed facility. Mm-hmm. That's how we brought these 2 things together.
Outstanding. And we put a link in there as far as how to find more information, because I know when people are watching this, Roger, they're going to want to know more about that. So I am so crazy grateful to have you on. And like I said, I'm just, your name came up several times. I'm like, all right, let's get him on. And sure enough, when it came to giving us some clarity around these issues, yeah. I'm so grateful. And like I said, we're going to have you back and take a deeper dive in all these things. So thank you so much for being on, Roger. Appreciate it.
Kirk, that's my pleasure. As you've gathered, it's what drives me. It's a passion in my life, and I am so blessed at this advanced stage of my life to be able to do what I do with the amazing bunch of people that I'm privileged to do it with. To me, that is a total blessing.
Well, you can see it. It's true. And so we're blessed to have you on, buddy. So I appreciate it. So stick around while we say goodbye to everybody else. But thank you guys for watching the Best Practices Show. And if you enjoyed today, which I know you did, just do us a favor. Hit the share button, share with your friends. Keep sending us suggestions for shows that you'd like to see with Roger, with anyone else. We'll do our best to line these up. I'm loving all the suggestions you guys have. And keep watching the Best Practices Show. You guys enjoy the rest of your day.